The Right Byte Sleep and TMJ Pain Care chain of clinics have been treating TMJ and sleep-related disorders across the globe. But the problem actually is that not many of us know about what TMD or a sleep disorder actually is. So, to make our lives easier, we are introducing a series of podcasts wherein we bring in guests and talk more about jaw disorders and sleep. So, on our first episode today, we have Dr. Rajesh Raveendranathan, who is also fondly known as Dr. Raj. So, he will be talking to us on TMJ and TMD. So, what is TMJ and what is TMD? We'll be getting to know more on that today. So, to start off our first episode, we have Dr. Raj with us. Hi, Dr. Raj.
Dr. Rajesh Raveendranathan.
So,
Hola.
I just said that you're the chairman of the Right Byte, but I feel that I haven't done justice to your introduction. So, why don't we hear it from the man himself?
Okay. Yep. As you rightly mentioned, I am the chairman of the Right Byte Sleep and TMJ Pain Care chain of clinics. It wasn't a chain earlier. We started out pretty small. My life has been an uphill struggle because of the lack of awareness, as you mentioned, of TMJ disorders, sleep disorders, postural issues, and how they are connected to where your teeth contact each other. So when I finished my education, I still studying, that's a different story. But when I finished my initial education and I came back to India, I do not know, I had no clue how to go about things. So fortunately, I had some good friends who gave me some guidance as to how to go about to be successful in this. And I found India to be the best place to be in because of obviously the population and to help your own mother country came to the top of my mind. So here I am in India, having 4 centers here and looking to spread our wings even more.
But the question really is as to how do I actually find you? So if I have a toothache, I look for a dentist. If I have a problem in my heart, I'm looking for a heart specialist. But how do I find you? Do I call you a dentist or what should I be calling you?
Okay, good question. We have cardiologists, we have ENT surgeons, we have dentists who are known as tooth doctors.
Okay.
I would like to rephrase that term. I heard one of my mentors speak about this term, oral physician. We as dentists, I'm a dentist, my whole team is dentists. We have other allied specialties like the ENT, the pulmonologist. You cannot work on the patient alone, but I'll get to that later. So we need to look more than just teeth. We need to look at the structures that are along with the teeth, structures that control the jaw position on which the teeth sit, like the muscles, the nerves, the joint, your airway, your tongue position, even your cervical position, because a wrong jaw position, a malformed jaw shape can affect the way you walk. It can change your gait. It would lead to changes in your food position. So you need to be aware of the physiology a little better and a little more than just looking at teeth only.
So are you telling me that all dentists can treat sleep and TMJ disorders?
Absolutely. But again, no thumb rule. I keep talking about this. It's my favorite word when I even teach my students NTR. Unlike the famous Telugu actor. But yes, no thumb rule. We're talking about medical science. We're talking about the human body. There's no generalization of anything. Every human being is different, which is what makes my job very exciting. I take like 8 to 10 flights every month. And I've been doing this for like 15 years now. And I haven't lost the energy. I'm still excited about tomorrow. That's because every patient is different. you need to become something like an investigating detective to find out what the causes of that disorder is or are. There are normally multiple causes, so finding those causes and removing them one by one has to be the job of not just the dentist, but a group of doctors, specialized doctors who can help with each of them.
So what is the specialization that we're talking about?
In broad terms, we call it neuromuscular dentistry. There are doctors who call it physiologic dentistry. There are doctors who even call it just physiological occlusion. It just. But I would like the term neuromuscular dentistry because that's the name that the organization approves. I'm talking about ICMO, and unless you work as a team of dentists, you cannot spread the word. So the biggest challenge to neuromuscular dentistry is to spread the word. And I believe with the Right Byte and thanks to podcasts like what we're doing right now, we keep making sure that the awareness is created. More and more people get to know about this. More and more doctors get to know about this. Because patients are just going around in circles. They do not know, like you said, aptly said, they don't know where to go. They don't know who to look for. Anyone who claims to be a TMJ specialist need not be looking at the right things. I'm not trying to disrespect anyone here, but it's just about are you removing all the causes so that you're taking care of all the problems, not just for the time being, but also for the future.
So how do you become a neuromuscular dentist?
It took me 15 years to understand, not everything. Even now we're still studying, right? So there's no end to the learning process. But yes, when I started out, there was not as much guidance, at least in our part of the world, in Asia, in India, in Middle East, South Asia. I had to go it the hard way. But then now we have ICMO spread across the world. The best way would be to join ICMO, attend a conference. We have international conferences every 2 years across the world in different venues. India hosted last year. The next one is in Japan in May 2025. And then follow that up with courses. There are a lot of doctors with a lot of experience teaching courses. We teach as well. We have a very specialized 1-year fellowship course that ends up with the ICMO fellowship. Our courses are not to be just promoting our course, but yes, our courses are full and all-encompassing. It takes care of. We teach you the TENS bite, the EMG bites, axiography. We teach you sleep dentistry. We teach you cranial nerves, sports. So DTR, occlusion, kind of the whole thing. So
and 15 years of neuromuscular
and our experience, yes. So it's more like our experience in a nutshell. Yeah. In 1 year. So, and that would be the ideal way to start. And then you can follow it up with your mastership, which then would show your prowess in the science. And all those who get their fellowship and masterships they're all mentioned on the website so that patients could, use that website and come search for you. Rest is up to how you handle your website and your patients.
So, doctor, jaw pains. So, tell us a little bit more about what the fuss is about. So, not everyone understands what jaw pain really is, but you seem to say that it needs to be taken quite seriously. So, tell us a bit more about why we should take jaw pains more seriously.
So, again, it's the lack of awareness. Patients don't take their jaw pains seriously, much like how they don't take snoring seriously. When you when you're chewing something and you bite on a stone unknowingly, that's going to create some pain. But that's acute, like short period, and it goes away. Chronic pains that don't go away, even with muscle relaxants or medicines, those are to be taken very seriously, because it's more like it's one of the symptoms of among a huge plethora of other symptoms, more like a syndrome. So TMJ disorders can be aptly called as a syndrome, because there are a lot of symptoms that are along with it. But again, it's to find out, the challenge is to find out what the actual cause of that jaw pain is. Whether it is tooth related, or whether it is muscle related, or whether it is jaw related, joint related, or even whether it is, a posture related issue. To find that out, you need to be a very good diagnostician. And this is another statement that I keep talking about. A good doctor has to be a very good diagnostician first, because if you're not able to diagnose just the cause, but also all the problems of that cause, you will not be able to treat that patient properly.
But before we go forward, I'm hearing two short forms here, TMD and TMJ. So what am I listening? So am I supposed to say TMJ, or am I supposed to be saying TMD? What do I have? Do I have a TMJ or do I have a TMD?
Yeah. So on a lighter note, we have a lot of patients who come and tell us that I have TMJ. Well, duh. Everyone has a TMJ. TMJ is the name of the joint. It's temporomandibular joint, which means it's an articulation. It's a joint that connects the temporal part of the skull with the mandible. So temporomandibular joint. The disorder is TMD. So TMD can be named as temporomandibular joint disorders or just temporomandibular disorders. So if there's a disorder, it's known as TMD, and that's a big difference, because when a patient says they have TMJ, you have to correct them. See, the problem is there's again with nomenclatures, full forms. I've even kind of stopped calling it TMD, because there's a huge number of patients, I put at almost 50%, where the TMJ is absolutely normal. There's on the CT scan, on the X-rays, on the radiology, we find nothing wrong with the TMJ. When you palpate, when you press the joint, there's no pain, but the rest of the face is in pain. The muscles are in pain, again, because of a faulty jaw position. We at ICMO have been trying to rename it as, it's a more complicated term, but I have to put it out there, CCMD. It's craniocervical mandibular disorder. So it's not just the TMJ that needs to be in a faulty situation. It could be any one of those components. So that's the new name that we're trying to push. Sorry for confusing it even more, but yeah.
But who gets a TMD? Okay, TMD. Who gets a TMD? So is there an age group that gets a TMD? Is there a gender specific disease? We don't know much about TMDs.
Yeah.
So is it possible for a perfectly healthy guy to get a TMD?
Absolutely. There's this research that proves 92% of the entire population of, I'm talking about human beings, because animals have TMJ too. Mammals, a lot of mammals have a TMJ. So 92% of the entire human population have a malocclusion. Now, what's a malocclusion? A malocclusion is where your teeth are not sitting right. The perfect occlusion. What is occlusion? Occlusion is how teeth sit. In a perfect occlusion, there's not supposed to be any problems. But then again, what's this? No thumb rule. right? So there's no thumb rule, NTR, right? So if there is 92% malocclusion, then out of the 8.5 billion people across the world, 7 billion have TMD.
Okay.
So it's just that people are not aware of it. They are waiting for these problems to get worse. They are again, it's not their fault, because they might have jaw pains, they might have headaches, they might have migraines, and they go to doctors and they get medicines prescribed. But it's just that no one's able to diagnose the cause of that headache or migraine.
So it's a killer disease of a sort, wherein you don't kind of...
Whoa, TMD doesn't kill you. But yes, one of the causes of TMD, sleep apnea, because if you have mild sleep apnea, you could be clenching a lot. I don't want to get into sleep part of it right now, but if you're clenching a lot because of an airway problem, which is again because the jaw has gone backwards, we can talk about that later. Those patients clench.
Okay.
And if they clench, all that pressure is coming into the jaw joint. So there's going to be wear and tear. So, okay, let me explain this a bit. What is a joint? A joint is where two bones meet.
Maybe I can help you show it better. I have a squeezy scar over here. So if you could point out...
I've got this as my squeezy. I'll talk about that later too. Yeah. Okay, show it to me. Yeah. So, man, this needs cleaning. Okay, so this is really old, okay? This is, I think I got it in 2003 or something. So if this is the skull, on the side, you can see how your lower jaw connects to the skull at this point.
Yeah.
And if you feel that point and you open close, you might need this to squeeze because you get stressed. So if you feel that point and you open close, that's your joint. Okay, so what is a joint? It's where two bones meet. And in this joint, between those two bones, you have a piece of tissue. It's like a cartilage known as the disc. I don't want to be explaining it in medical terms so that the layman person understands. If there is a lot of pressure in that joint, there's a lot of pressure on that tissue. Over years, that tissue is going to start wearing away. Okay? Once that tissue starts wearing away, then those two bones start touching and you start hearing those clicks. But it's actually because the tissue has gone ahead and is trying to recapture. But for you to understand, it's when the space reduces, those two bones touching, and later on, if you do nothing about it, those two bones start fusing.
But how much time does it take? What's the age?
Whoa, again, there's no way that you could give a timeline to that. If you're hearing clicks today, you might go into a lock tomorrow.
Are you saying an 18-year-old college-going guy could
My
have a
youngest patient was 3 years old.
Okay.
My oldest patient was 92.
Oh.
So I don't think I could put an age limit to any of these issues because it's not just the joint. That's what I'm trying to say. It's the tongue. It's from birth. If you have a tongue tie, if you've not been breastfed well enough, if you've been bottle fed for a long period of time, the tongue posture changes. The tongue is the biggest muscle in your head area. So if that tongue is not in the right place, meaning it has to be on the palate the whole time, then during your growth phase, these bones don't grow well enough.
But even before I visit you or get to understand this, how do I kind of realize it myself or figure out myself? What are the symptoms that I can myself figure out at home, saying that probably I might have a TMD. I need to visit someone.
Yeah. So, like I said, no thumb rule. Just because you have a headache doesn't mean you have TMD. Just because you have jaw pain doesn't mean you have TMD. Because that jaw pain could be a tooth-related one or a neck-related one or even some sort of an abscess. It could be anything. So, it's all about diagnosis. For a patient to self-diagnose, if you have a headache and if you press your joint and you try to open and close and you have any sort of pain, bam, it's time to visit your doctor. If you're not able to open your mouth properly, time to visit a TMJ specialist.
So say I'm eating a burger, and this has happened to me before.
Okay.
So I open my jaw.
You're part of the 92%.
I open my jaw wide enough to get that burger inside my mouth.
Uh-huh.
And once I try to bite into that burger, there's something, it feels like it's stuck. So
Yeah.
is that TMD?
The burger is tasty, but the TMD is not. Because when you try to open that much, so here's the thing. People think they need to open 3 fingers and 4 fingers, put your whole fist in. What I tell is, you're not a hippopotamus. You don't need to open your mouth 90 degrees. Okay, you try to make sure you have 2.5 finger opening. That's enough. Okay. Now, to taste that burger well, you need to get that whole thing into your mouth. That's when your the taste buds in your tongue affects, and it gets the right taste and everything. But if there is pain at that point of time, it's okay. That's just once. Okay. If you keep getting the pain, or if that pain doesn't go away with just medicines, then it's time to visit a TMJ specialist.
Fair enough.
Yeah. And it's not just the TMJ where you could get the pain. When you're trying to open up wide and trying to chew, you might end up with ear pain. You might end up with pain behind the eye. You might end up with pain in your throat. So, which is why patients and doctors alike, and dentists and neuromuscular dentists as well, I come back to that term, diagnosis. It's very important. So when we diagnose a patient, we have a 20-page booklet which covers all of this from head to toe. So our consultation protocol involves like almost an hour of talking with the patient. Well, mainly because we're trying to keep the patient at ease. Because most of these patients, they've been in pain for years together. Because they're not getting any help. So they've been in pain for years, and they're anxious, they're stressed out, they're even on medication. So we need to calm them. Once they start filling the form, they're like, okay, yeah, makes sense to me now. So I wished more and more dentists would do that.
Also, don't you think it's because of the word itself sounds so complex that people probably are not aware enough that it needs a simple word, like say a migraine. When you said migraine, for that matter,
Okay.
Migraine is more relatable. I think everyone connects to migraines better. And you also said there's a connection between migraines and TMDs.
Yeah.
Would you?
Well, okay. So there's no connection directly. It's the problem with the diagnosis of migraine. Again, not to disrespect anyone, but the idea of headaches, chronic headaches, suppose you have a headache, who would you go to? You would go to an ENT or a neurologist.
Yeah.
They put you on medicines. The headache doesn't go. They try other medicines, still doesn't go. And that's when you get diagnosed with migraine. I don't support that because you've missed the TMJ. So test the TMJ as well. What if, so the symptoms that migraine has and the symptoms that TMD has, it's kind of, overlapping each other. So you need to be very careful when you make the diagnosis. So my message to the general doctors as well as the patients out there is that just check the TMJ as well. Who knows? The TMJ could be causing that migraine. So the headache, because the actual migraine is not TMD. It's the falsely diagnosed migraine, which could be TMD.
So, doctor, coming to the treatment of TMD, how is there a cure for TMD, as such?
Whoa, okay, cure. That 4-letter word is a very dangerous one, because any medical ailment, for that matter, there's every possibility for anything to come back, like a relapse. So we don't call it a cure, we call it treatment, or we try to make sure that as per current knowledge, the medical science that's out there, the research that's being done, we try to keep ourselves updated so that there are no future causes for that problem to come back again. But yes, treatment there is. But if I need to talk about treatment, you need to understand why the problem happens in the first place. So when I said there's a joint and there's a gap in between and the gap is reducing, and the pressure on that nerve when they clench or when they chew, that pain, because the nerves that travel through there, they supply almost 95% of the muscles of the head and neck. So most of it is muscle pain, which is why the importance on diagnosis. We need to know which muscles. But once we get to know that, then the treatment becomes much easier. Which is why we also need to touch upon sleep, because if your jaw is backward positioned, which generally it is, it's known as a deep bite, or in layman terms, where when you bite your teeth, you can't see your lower teeth at all. It's literally because the jaw has gone upwards and backwards. What we tend to forget is the jaw, the tongue is connected to the jaw. So if the jaw goes upward and backwards, so would the tongue. So when the tongue goes backwards and during sleep, it blocks your airway. So you can't breathe in oxygen, which is dangerous. And that leads to sleep apnea. But what it also leads to is a clenching event, a bruxing event. So when you clench or brux, there's going to be pressure within that joint again, and the muscles tighten. When those muscles tighten beyond its saturation limit, then the pain starts. So our focus is to get those muscles relaxed. When you relax those muscles, the jaw, what's gone upward and backwards, comes downward and forward. Generally, again, no thumb rule. So when it does come downward and forward, the joint gets decompressed, the airway gets decompressed. So we provide them with very specific splints that we like to call orthotics. Mm-hmm. The reason why we call them orthotics is because they're just like teeth. They are snap-on, they fit onto your lower teeth. It's removable. And we provide them on the lower teeth and not on the upper, because the lower is the mobile jaw. The upper is fixed to the skull. So the muscles control the lower jaw. So if we need to get those muscles relaxed, we need to give a lower orthotic. And when they wear them, the muscles start relaxing. We're kind of reprogramming those muscles to come to the new position in that decompressed position, so that the pain slowly moves away. It's not magic. The pain doesn't go off, in a day. It takes time, because I believe your next question is, would there be surgery? Because we don't believe in surgery. Yes, surgery is required depending on the diagnosis, but again, for 80% of our patients, surgery is not required. Once we get the muscles relaxed, once we get the disc back into position, then the pain goes away. So the orthotics during the daytime, they wear it the whole time, while eating, while talking. A lot of patients are being advised to wear splints and remove them while they are eating. No. If you remove them while they're eating, they go back into the old position again. So there's again going to be decompression and the muscles get confused. So we need to provide them orthotics that would reprogram the muscles into the new position, that is where all the structures in the face are happy.
So, but then again, if you're saying there's no cure for TMD as such, am I constantly or always coming into the clinic for the rest of my life?
Till some extraneous forces act on you. Like, suppose you are a cardiac patient and you undergo a bypass surgery. The doctors advise you not to smoke again. They ask you to stay away from oily foods. Why? So that it doesn't happen again. Those are the causes we know, generally speaking, that could make it happen again. Same thing here. What if once you're taken care of, I wouldn't use the word cure, never. Once you're taken care of, suppose, again, you're eating something and you bite on a stone or burger and it gets locked. Do not worry. That's just once. That's not TMD. That can happen to any healthy individual. So let's not be under that wrong or misconception that, oh, I've got TMD again. No, don't worry. Try to lead a stress-free life. Stop thinking about these issues and enjoy the time that you have on this earth.
So, what's the course of the treatment that we're talking? What's the time that we take?
Time frame.
Yeah.
Again, very difficult to predict. Every human being is different. Different bodies, different humans respond to the treatment in different way, which is why we keep following up with the patient even after treatment. So the treatment is generally divided into two phases: the first phase and the second phase. The first phase is where we try to get the patient into 80-85% of their difficulties, not just pains, any kind of difficulty. So it would involve wearing the orthotic, getting the joint decompressed so that the headaches are off, the pains are off, they can start eating normal. We take care of their tongue physiology, their tongue issues, relieve them of the tongue tie, which would prevent them from having their tongue on the palate, causing them to have sleep apnea and bruxism and other issues. We take care of that. We do some chiropractic adjustments on the neck with Rocobado distraction techniques. So you can't wear the orthotic lifelong because, we do advise certain patients when they're really old or aged patients, or if they have no teeth at all, maybe even implant supported processes. But the fact is, we need to get them off and then you become the dentist, because we need to maintain that jaw position. So if you remove the orthotic and the jaw goes back in, the whole process of that first phase goes to dust. So we need to stop that. And how do we do that? By maintaining the jaw position, by moving the teeth to maintain that new jaw position, the reprogrammed muscle jaw position. How do we do that? With braces, with crowns, prosthetics. But when we do braces, we also do a lot of expansion, because most of these patients have a very narrow jaw, which relates to a very narrow airway, which could then cause a problem again. So like I said in the beginning, we have to remove all the causes. I give this example to patients. If there are 4 or 5 thorns in your hand, you're going to have pain. And generally we go and buy medicines if there's any pain, and the medicines would help for the time being. But the challenge is to find out where those 5 thorns are and remove them all. If there's 1 thorn remaining, pain's going to come back, which is why I said you got to be a good diagnostician. So that palate also has to be expanded, and that we do it during the second phase. And there are a lot of appliances out there that help in that matter. Again, it's about not doing it for everyone. It depends on the diagnosis. So when patients, because of my traveling and everything, I get to do a lot of online consultations. When they ask for a diagnosis or a treatment regimen online, I say no, because I got to see that person in person. I have to see his data with his CT scans and his sleep studies and the MRI reports, because they're all very important. Every single diagnostic test that we ask the patient to do helps us in the better treatment for our patients.
But how do you see the awareness in the West? How are people reacting to jaw disorders? Are they doing it any better than we are doing here back in Asia?
Well, the awareness is much higher, but not as much as you would expect it to, because, like I said, there are different schools of thought. So the doctors do a lot of other stuff, but they know their stuff. But back here, the awareness is pretty grim. As an example, the role of the tongue. There are tongue tie specialists in the delivery ward in certain good hospitals, a lot of good hospitals in the West, in the developed world. I'm not talking about the Western Hemisphere, I'm talking about the developed world. But there are only 2 or 3 in India, unfortunately. If you can take care of the tongue tie as soon as the baby is born, then they may not be a patient in the future. Because tongue ties play a huge role in the development of TMD. We can talk about that in a different podcast. But so when it comes to sleep studies, in certain states in the West, in the US, to renew your insurance, you need to do a sleep study. You don't even know what a sleep study is. So, which is where the awareness is really bad, really poor. There's a lot of work that we need to do, that the general public needs to do, that the government needs to do, that specialist organizations of doctors need to do to create more awareness, and especially the dentists.
So do you have a bizarre or a weird patient story that you've got across in this 15 years of time?
Lots of them. Oh my God, now you're putting me in the dock. Yes, I do actually. I won't forget this one patient who we helped. So this bizarre story is about keeping your mind open.
Okay.
It's you need to accept any kind of science. If it's working for the patient, great. I have two stories. I'll tell you one of them. We helped the patient. The patient came to us with headaches and migraines for 25 years. He knew he had a TMJ problem. He'd been going around in circles, and he came to us. We gave him an orthotic. We gave him a sleep appliance. We did all the stuff, and we went through the entire protocol, and he was fine in about a year's time. That's good recovery. He was very happy. He got back into work. Okay. Till then, he was taking a break, like a sabbatical, because he knew work was a lot of stress. He went back into work. Stress came back, and he was at our office in 2 months' time, back with the same pain. He's wearing the orthotic sleep appliance, but he's back at pain. We did a lot of stuff, didn't help him. And after 6 months, he came back to us, asking to get the orthotic corrected. We did the corrections, and the next month he came back, no pain. So I asked, what happened? What do you do? He met this homeopathic doctor who who went through his stars. They call it the Janam Kundli here. And they they found out that his stars have got to do with some crustaceans in his previous birth. They got some juice out of it and started having it, and it helped him. I'm like, okay, I don't understand the science, but it worked on him.
Okay.
Why? Right? So these are questions still waiting to be answered. I know it's a hugely bizarre story, but there's another story that I'd like to say. I was at a conference in Switzerland recently, and there is this science about energies, chakra healing, Reiki healing, and just energy healing. So I'm talking about all of this, measuring that, and here comes this doctor who treats TMD, wearing orthotics and checking the bites and everything. But how he relaxes muscles is in a very bizarre way of doing something over the head, not even touching the person, removing the negative energies. So these are all
like waving
away the bad energy stuff. It sounds funny, but guess what I did? I went and bought the book that talks about this because I'm intrigued. I want to know. I want to know what's happening because that's how I am. I'm a very fun-loving, free-thinking guy, and I am open to anything that helps a patient but should make sense to me.
Yeah.
So if he's able to help those patients by just waving, great. I want to know that. Because a lot of our patients who come to us with years of pain, you would get, psychologically depressed, mentally stressed, anxiety, a lot of other issues are bound to come up. So it is the role of the doctor to make sure those are also away. So if there is a way and you can avoid medicines to get rid of that, I'm game for that. Just a bizarre story that I said. I know it's too bizarre, but there you go.
Yeah. So, doctor, we're coming to the last leg of this podcast.
Okay.
So, a final message to everyone out there who are ignoring their TMD symptoms. What do you have to say to them?
Oh, okay. Well, don't worry. You're not going to die of TMD. But yes, there is every possibility that something that causes TMD, like sleep apnea, can kill you. So just be aware that to have yourself tested for your sleep. Ask your local dentist, your family physician, if you could do a sleep study. Make sure you don't hear any clicks in your joint. If you do, visit your dentist. Or the easiest way, come to us. Easier said than done, but it's not that practical for everyone to understand what their problem is. So my message should be actually short and simple. I would say unlock relief, the magic of relief, as soon as you can. The more you delay it, the worse it's going to get. Because once it locks, once your joint locks, then the pain is unbearable and the treatment involves surgery and it's very invasive. So the earlier, the better. Prevention is better than cure.
Prevention is better.
No doubt about it. Yeah, that's the the final nail in the coffin. But inshallah, I hope no one gets any other problems. And I love this Russian word. Don't be tupoi, and mean stupid. And get yourself checked as soon as you can.
Get yourself checked as soon as you can, guys. And with that, we come to the end of episode 1. And it's been a great time talking to Dr. Raj about jaw disorders. But I think there is a lot more to talk about. We have sleep, we have smile design, so which we're going to cover in the upcoming episodes. So I want you all to stay tuned to this YouTube channel. Probably subscribe, give us a like, thumbs up. Yeah.
Catch.